My name is Geralyn Johnson. I would like to discuss rare cancers of the thymus and how you can help in the search for improved treatments and possibly a cure. It's important to understand what these diseases are, who treats these patients, what a patient experiences, and what's been accomplished thus far. The thymus's friend or foe. The thymus's friend is a small organ in the upper chest behind the sternum. During fetal development and childhood, it helps the immune system fight off infections. It grows to its largest size in puberty and gradually shrinks in adulthood. The thymus as foe. Sometimes the thymus doesn't shrink. It develops into one of two kinds of tumors. These tumors are known as malignancies or cancer. 90% of these are called thymomas. These are generally small and slow-growing, but may become aggressive and spread. 1 out of 10 of these tumors can become thymic carcinoma, and these are generally more aggressive than thymomas and spread throughout the body. Why do we consider these cancers rare? Well, tumors of the thymus consist of less than 1% of all cancers. Said another way, in the United States, only 500 to 1,000 people are diagnosed with thymoma or thymic carcinoma each year. Understanding rare cancers from a patient's experience. I'm a thymoma patient. In 2005, I was diagnosed with a rare autoimmune disease known as myasthenia gravis. At that time, a CT scan found that I had a thymoma, and I was referred to a thoracic surgeon for removal. After major surgery, I was told the thymoma had been encapsulated, everything was removed, and there was no need for further follow-up. Several years later, it was found that the thymoma had grown back and was very large. I underwent 16 weeks of chemotherapy to try and shrink the tumor. This was followed by a second, more extensive surgery. 3 weeks later, I had a severe setback that almost took my life, and I was back in the hospital for more surgery. After that, I had 30 radiation treatments over 6 weeks. Then I was monitored very closely. But a few years later, it was found that a couple more tumors had started to grow. I was put on a different kind of chemotherapy, and that lasted about 9 months. Then the tumor started to grow again. A new kind of chemotherapy has kept the tumors from growing ever since. This has had a major physical, emotional, and financial impact on myself and my family. Sadly, this is not an uncommon course for this type of disease. When you're given this kind of a diagnosis, your life is taken over by specialist appointments, tests, and treatments. You want to be sure that you're receiving the best care by physicians who are familiar with the disease. In the past, there were very few physicians who were familiar with thymoma or thymic carcinoma, and there was very little knowledge to be shared. Patients searching for answers. Patient advocates and their families recognize that without international collaboration between physicians and scientists treating thymic malignancies, no progress would be made. They contacted specialists on all continents and in multiple countries, and in 2003, the Foundation for Thymic Cancer Research was formed. In 2007 and 2008, they offered workshops that brought together oncologists, radiologists, radiation oncologists, pathologists, and surgeons. This led to a collaboration with the National Institutes of Health in the United States, and in 2009, the first International Thymic Malignancy Conference was held. This led to the development of the International Thymic Malignancy Interest Group, otherwise known as ITMIG, in 2010. ITMIG is a 501c3 nonprofit organization dedicating to the advancement of understanding and treatment of thymic malignancies and related conditions. This is accomplished by physicians and scientists who give of their time to perform research, educate, and help other scientists and patients. What has ITMIG accomplished? In its 10 years of existence, ITMIG has made tremendous strides in advancing the science and knowledge of thymic disease. They developed a retrospective database. This contains over 9,000 cases from 30 years of experience. Information from this database has been used in scientific publications on the management of thymic disease. They developed a prospective database. Here, detailed, de-identified patient information can be listed and used for more rigorous research than that from the retrospective database. They developed a virtual tumor bank. Here, individual members can list tumor tissue that they have acquired that is available for scientific research. ITMIG has published several scientific articles that set the standards for treatment for thymic tumors. These standards have been adopted by other thoracic oncology organizations and are used in the management of these patients. They also have developed a website, www.itmig.org. This offers education and information for professionals, patients, and others that are interested in these diseases. Ongoing activities for professionals. ITMIG conducts an annual scientific meeting to allow for presentation of cutting-edge research and collaboration. These meetings are funded by industry contributions and delegate registration fees. Speakers donate their time to the organization. These meetings rotate between North America, Europe, and Asia to allow for a true international sharing of ideas and expertise. Research. ITMIG members continually develop new research projects to explore the complexities and scope of these diseases and develop new treatments and possibly a cure. Tumor Board. Members seeking advice are allowed to submit specific cases to be reviewed by professionals. These can then be discussed in a real-time fashion, and advice is offered on the treatment for the patients. For patients. ITMIG offers webinars. Patients are allowed to submit questions that are then answered by professionals. Recordings of these webinars are available on the website. Social media. Members and volunteers develop and continually update social media so that patients and professionals are able to stay current on what is going on with the organization. There is also a very active Facebook support group for patients. Funding. In addition to paying an annual membership fee, members give of their time by serving on committees, participating in fundraising activities, and assisting with various other activities of the organization. Numerous volunteer hours are donated by family members and patients themselves. They also serve on committees, manage social media sites, assist with administrative outreach, and fundraise. Outside funding. Research funding is difficult to obtain for even the most well-known of diseases. For something as rare as thymic disease, it is almost non-existent. Before a funder will grant monies to an organization, they want to be assured that the organization has a strong base of financial support so that they're able to continue a project after the grant is used. How you can help. In order to continue to expand in its international collaboration and cooperation into the research and understanding of these diseases, ITMIG needs to increase its base of financial support. This is where you can help. Most of this support comes from private funders. If you're able to make a donation, you can do it directly to ITMIG through the website, www.itmig.org. Another way you can help is by designating ITMIG as your charity of choice on the Amazon Smile program. Or you can develop and run a fundraiser for ITMIG. Any financial donation you can make would be greatly appreciated by thousands and thousands of patients, families, caregivers, and professionals. Other support. In-kind support can be given by volunteering or by goods and services. If you're able to volunteer, or if you have goods and services that you can donate for general operating uses or for our annual convention, please contact Pam Bruce. She's at pbruce@thymic, ITMIG.org. Over the past several years, I've volunteered with ITMIG, and I was able to attend the last international conference. During this time, I've met many physicians and others involved in the organization. Their dedication to the patients, the research, and teaching others about the disease is amazing. They freely give numerous hours of their time to advancing the science and development of international cooperation and coordination. The accomplishments on the understanding of the disease and the international relationships that have been developed are beyond comparison. I'm fortunate to live in an area of the country where it's access to some of the top thymoma and thymic carcinoma specialists. Not everyone is so fortunate. You never know when you or someone you love will receive the news that you have a life-altering, very rare disease. After the fear and shock, you want to be sure that those who are responsible for your care have access to the most current information on your treatment. Please visit the website www.itmig.org to learn more about this disease and this organization. Then do whatever you can to help advance the work of this organization so that many more patients will have access to the top care for their disease. If you have questions about this video or anything about the organization, please put them in the comment section below. Thank you very much.